Hello medicos, today we are going to see coronary steal phenomenon by dipyridamole drug. See, this is my coronary artery and it is dividing into two branches, and these are the resistance vessels. Okay. This is ventricular wall. Okay. Now here there is plaque, atherosclerotic plaque. What happens now? The blood flow to this region is normal, but the blood flow to this region is decreased. This is ischemic zone. This is non-ischemic zone. Okay. Now what happens? These resistance vessels are autoregulatory. What happens? These resistance vessels will dilate. Now due to this dilation, there is increased blood flow to this ischemic zone. Okay. This is normal. This happens in our body when there is ischemia. These autoregulatory resistant vessels will dilate and increase the blood flow to this ischemic zone. But dipyridamole, will act on these vessels and they will dilate these. Due to the dilation of these vessels, there is increased blood flow to this non-ischemic zone. So what happens? The blood flow which was going to the ischemic zone will now go to the non-ischemic zone. So there is stealing of blood from the ischemic zone to the non-ischemic zone. This is known as coronary steal phenomenon. Okay. Now how it happens? Let's see. During ischemia, there is increased adenosine. See, at this area there is increased adenosine, which is a local mediator. What it will do? See, this is smooth muscle cell. These are adenosine receptors A2A, A2B. Both are GS, so they will activate adenyl cyclase. Okay. What further will happen? There is conversion of ATP into cyclic AMP, then formation of protein kinase A. What this protein kinase A will do? It will convert myosin light chain kinase into myosin light chain kinase phosphorylated form. So what is happening? This myosin light chain kinase is active form. It has more affinity for calcium calmodulin complex, and this myosin light chain kinase in phosphorylated form is inactive. It has less affinity for calcium calmodulin complex. So the myosin light chain, which needs to be phosphorylated to become active, to act along with actin, it will cause smooth muscle cell contraction. It is done by this myosin light chain kinase along with calcium calmodulin complex. So now the adenosine acts on A2A and A2B receptors. It increases protein kinase A. Due to this, myosin light chain kinase is phosphorylated. Now there will be decreased contraction. There is smooth muscle cell relaxation. So it causes vasodilation. Okay. Now what happens? Adenosine is increased in the ischemic zone, and there is relaxation of these smooth muscle cells in the resistant vessels. So there is increased blood flow to this ischemic zone. Okay. Now what dipyridamole does? See. Dipyridamole inhibits adenosine uptake. See, these are cells, RBCs or endothelial cells, which have ENT. ENT is equilibrative nucleoside transporter. Okay, what happens? This adenosine uptake is inhibited by this dipyridamole. Now, dipyridamole inhibits adenosine uptake by these cells. Now, there is increased level of adenosine. Okay. Another one thing is, it will also inhibit phosphodiesterase 3. Okay. Now, by increasing the adenosine in this non-ischemic zone, now the same way how in the ischemic zone adenosine acts, in the non-ischemic zone too, because of dipyridamole, there is increased adenosine. It will cause smooth muscle cell relaxation. So there is vasodilation, increased blood flow to this non-ischemic zone. This is how dipyridamole causes coronary steal phenomenon. And due to this inhibition of phosphodiesterase 3, see, if you are not watching my previous video on platelet aggregation, just once go and watch it. There I would have explained that the cyclic AMP levels are important. See, cyclic AMP is converted into 5-AMP by this phosphodiesterase 3. What happens? Because of the inhibition of phosphodiesterase 3 by dipyridamole, there is increased cyclic AMP levels. There is increased protein kinase A. So now VASP will be converted into VASP phosphorylated form. So this VASP, which was required for activation of GP2B 3A complex, will not be there. So there is anti-aggregatory effect. So dipyridamole has anti-aggregatory effect on platelets. So see, dipyridamole, what it does coronary steal phenomenon. It steals the blood from the ischemic zone to the non-ischemic zone. How? Through the adenosine. It increases the adenosine levels in the non-ischemic zone. So it causes vasodilation, leads to the increased blood flow. See, another thing is, I would have explained in the previous video also, on platelets there are adenosine receptors A2A and A2B. Now because of this increased adenosine levels, adenosine can also act on these A2A and A2B receptors on platelets. So what happens because of this? These are GS. So the same way GS increases cyclic AMP, protein kinase A, and then further it will inhibit platelet aggregation. So what are the other drugs which can cause this coronary steal phenomenon? See, we saw adenosine, dipyridamole causes, and adenosine also causes. And there is isoflurane, which is a general anesthesia, and then sodium nitroprusside. See, this isoflurane, it causes coronary steal phenomenon, but it is on the theoretical grounds. Sorry. See, isoflurane causes coronary steal phenomenon. It is just theoretically said, but no clinically has been seen, not seen in clinical. Okay, this is how adenosine causes anti-aggregatory effect, and this is how dipyridamole causes coronary steal phenomenon. Thank you.